Here we have MRI of the lumbosacral spine on 15-year-old boy with history of subacute low back pain, especially on the right side. On further digging of the history, this boy plays semi-professional cricket and is a right arm fast bowler. So what we have got here is sagittal T2, T1 and stir sequences. If we look carefully at the pars interarticularis, so this is pars on the left side which shows normal signal on stir, and here we have got pars on the right side which shows significant abnormal signal. On the sagittal T1 there is no evidence of fracture of the pars interarticularis on either side. So these features are most likely to represent significant stress edema in the right side of the pars interarticularis with no evidence of fracture or listhesis. So these features are suggestive of impending fracture, hence needs to be treated conservatively to make sure to avoid the pars stress edema does not progress to fracture and listhesis. In summary, here is a case of MRI lumbosacral spine in young patient showing unilateral pars edema and correlates with right arm fast bowling.